Tippah County Hospital is a vital entity because it's the safety net. It's the anchor for healthcare services in the county. That's not to say that we don't have clinics and we don't have healthcare providers in our community, but the anchor is the hospital and has been for 72 years.
Tippah County Hospital is a intricate partner in the health care of our citizens. We are the lifeline between these patients from the time they get here to the time that we can either transfer them to a different facility or we can monitor them in our emergency room to maintain their status until they are accepted elsewhere.
We're a small rural community and everybody seems like they know everybody. And everybody's probably got a story where they have saved a life here, you know, in a small rural hospital. And my brother's one of them. He had an accident, and if it wasn't for this hospital, he wouldn't be here today.
We tried telehealth before the Delta program. We had telestroke in our emergency room. One of the really big things we learned from that failure was you can bring a piece of equipment and kind of poke around and say, hey, push this button and do this and hope for the best. But until you immerse them in it and teach them how to use it in a scenario-based way, they're not going to adopt it.
The Delta program opened the door for this telehealth program for us. And without it, we probably wouldn't be able to open this door at this time. Through the equipment grant and through the education, the support, and the feedback, we were able to get this program off the ground.
The Delta program was instrumental in overcoming one of the biggest barriers that I think we're not alone in, Tippah County Hospital is not alone in, and that is funding to support purchase of the equipment needed to perform telehealth or telemedicine visits. It can get rather pricey, and we were fortunate enough to be allowed to submit project plans to the Delta program to purchase carts and other equipment to overcome the barrier of equipment. And I really don't think we would be where we are today with telehealth without that financial support.
It gets more comfortable every day to use telemedicine. You know, you have to learn the technology, you have to you perceive it differently when you're in front of a patient than the thought of doing telehealth, you know, just with our coworkers talking. We have to be very mindful and spend extra time with the patient because we're not face to face. So my perspective has changed definitely during the COVID-19 pandemic because this was a much needed technology for us during that time.
In our rural environment, we have limited access to home health services. You have 2 companies to pretty much choose from, and in a certain area, you don't even have but one to choose from. Whenever these nurses from home health go out to these rural community households or whatever, I mean, they're going back in the sticks. So I don't think they can take on the patient load that other probably areas could take on. Because we're offering telehealth services, both specialty, both mental health, and inpatient access to that, it has helped reduce our readmission rate. It's been a big factor in reducing our readmission rate by around 20% from previous year, and that's even during a pandemic.
I believe in technology. I believe it's the future. I believe this is where healthcare is going, and I think if we're not on the leading edge, if we're not one of the first movers in the program, then we're going to get left behind. Without the hospital, there would be far less access to care. Factories, businesses, schools would be so vulnerable without the hospital here. So we have to have a hospital in our community.